This is Dr. Charles Parker, and you're listening to Core Brain Journal. It's a place where I connect both fresh discoveries and interesting different perspectives from advanced mind science with the realities of real people and everyday life down on Main Street. Well, welcome, folks. Dr. Charles Parker here for another episode of Core Brain Journal. And we have a guest today who is right on the same path with me, folks. Those of you who've been, hanging out with me for 10 years at Core Psych when I was writing there. Those of you who've been with me through Core Brain Journal for a year now. We're very interested in executive function disorders. We're interested in the fact that ADHD, ADD is really a fashion show diagnosis based on appearances of behavior, and really has only some provocative ideas about the underlying biomedical issues at play. So you're going to be interested in our guest today. This is Dr. James Greenblatt is here. And welcome, Jim. We're pleased to have you on board.
Thank you, Charles, for having me. I'm looking forward to it.
So Dr. James Greenblatt is going to talk about ADHD and executive function, but he's going to talk about it from a perspective of a more comprehensive view beyond just appearances and throwing meds at people based on how they look and superficial behaviors. So to introduce him, Dr. Greenblatt's book, Finally Focused, is a book-length prescription, and it's a manual that provides all the background information and practical guidelines needed to confidently treat your ADHD child or yourself. The book and your efforts will be enough to effectively relieve the symptoms of ADHD, will help you learn how to balance it, and thereby manage imbalanced, counterproductive behaviors of all kinds. If medication is necessary, Dr. Greenblatt's approach will minimize any side effects by using natural treatments first and medications only when necessary. So this is going to be a very interesting, if you'll forgive the expression, alternative view of ADHD treatment, and we're looking forward to it. So, Jim, tell us, how did you get into this whole thought pattern of looking at additional things? Tell us a little more about how you came to this point in your life.
Well, I actually went to medical school, interested in nutrition and brain function, and, ended up going into child psychiatry, and I came out, a child psychiatrist, and most of what I did was write prescriptions for children. And a child psychiatrist, ADHD was the vast majority of the kids that I saw. And I very quickly realized that, one, medications were just the Band-Aid, symptomatic relief. Two, a lot of kids had side effects. So I started going back to why I went to medical school, looking at the relationship between diet and environment and metabolism and how that might affect behavior. And that's when I started integrating it into my practice. And I've been doing this almost 30 years now. Long
distance high five, Jim. I love that word, metabolism. Yeah. That's I only use it about 50 times a day. So it's going to be very interesting hearing about your perspective. So you are currently, where are you located in the country, and what do you do professionally at this point?
Yes, I'm in the Boston area, outside of Boston, and I run a hospital network where we treat all kinds of psychiatric disorders called Walden Behavioral Care. So I'm Chief Medical Officer of Walden Behavioral Care. And as a child psychiatrist, I've been treating ADHD for many, many years.
Fantastic. Do you walk around Walden Pond?
It's pretty close. Yeah, it's about 10 miles away.
That sounds beautiful. I love it up there. My wife is from North Shore, Boston, and my daughter lives up in Camden, Maine, so we love that part of the country. So back to it. So then let's talk about your book and really get down to your thought that you're in quite agreement with me. It's a behavioral disorder from the outside, but it's far more than that on the inside. So how did you dive into a more functional medicine, integrative approach to understanding executive function challenges?
Well, I think the most important concept in this integrative or functional medicine approach is that, everybody is different, even though might have the same behavior, impulsivity or overactivity. When we kind of dig down and look at metabolism or nutritional deficiencies, we find a whole host of problems. And that's kind of the goal of the book, is to help parents and professionals understand that list of things that could be going on. So, ADHD is not a Ritalin deficiency, and it's not a deficiency of one nutrient. We kind of look through some of it through testing, some of it through symptoms, how an individual can kind of determine what makes the most sense for them. Part of the reason I decided to write this book at this point in my career is that, patients were reading something in a magazine, or a health food clerk would just tell them, take this vitamin. The parents tried it for 2 weeks, nothing happened, right, and they gave up. So our goal was to try to bring it into something parents can use.
So that sounds absolutely right in concert with what I am. And I don't mean to put you on the spot, but I'm absolutely curious about it from a professional to professional point of view. This is what I think is intriguing about this, because we got two medical people interested in the same thing, and we're having, yes, it's a private conversation, but thousands of people are going to hear it. So, but it's a private conversation in a certain way, because I'm going to learn from you and ask you to tell me some solutions that you found from your own personal perspective. And one of the first things I want to ask about, that I'm quite curious about, is the testing. I mean, if you're a functional medicine person and you're thinking about the complexity of the biomedical, metabolic issues, how do you evaluate somebody? What's your thought about the evaluation process that needs to take place to be precise about the medications and the supplements that you use, if you use medications?
Well, the ideal package, which some individuals can't afford, is really looking at a broad range of testing. So I look at genetic testing, a cheek swab looking at genes, how you metabolize certain vitamins and minerals, can be helpful to predict nutrients that you might need. I look at the gut. I look at tests that will tell us if there's dysbiosis, problems in the GI tract. And I look for levels of minerals, magnesium and zinc and iron, all associated with ADHD.
Great.
So that's why we might have 10 kids with the same symptoms, yep, but different underlying problems.
I got excited. I'm sorry I interrupted you, but I mean, this is great, because we're definitely on the same path. So let's start with the genetics, and then we'll hit the gut, and then we'll hit the trace elements and so on. Do you mind telling us what laboratory is your favorite laboratory for genetic testing?
Well, the lab that I'm using now is called Genomind.
Yeah.
It was set up for, helping physicians prescribe medications, mm-hmm, but also look at supplements. So we look at gene, MTHFR gene, how you metabolize folate. Mm-hmm. We look at genes that tell you how you might respond to a stimulant or not. Mm-hmm. And we look at genes that might also help us how you respond to other medications and or supplements. So the Genomind is a genetic test that I do on everyone I see. Yeah,
so we've met Jay Lombard. He's a very interesting guy and has been very helpful. And Jay Lombard, as the medical director last time I checked, of
he's a good friend and he's very smart. Yeah.
So he lives up there near where you do, doesn't he?
He's in New York City.
Oh, he's in New York City. Okay. Yeah, Jay is a great guy, and there's some very interesting things. What you can find is not only the pathways in the liver, which are cytochrome P450 pathways. They're all pipelines in the liver, and different medications go through different pipelines in different ways. And sometimes people are treatment failures just because those pipelines aren't operating on a functional level appropriately for the medication you may wish to use. So that measurement is a big one. That's very, very good. And Genomind is one of the thought leaders in that regard.
Yes.
So then the next one is first of all, some of our audience doesn't know what dysbiosis is. So let's talk a little bit about gut, dysbiosis, and all that sort of thing, and how that might figure into treatment failure. One of the things I think you and I are talking about right now is treatment failure. So you can make the diagnosis on the outside, but if we got treatment failure, we have biomedical conditions, metabolic issues going on the inside. So let's talk about gut and gut dysbiosis.
Great. I think it's really important. Not every child with ADHD has it, but when we pick it up, it's really treatable. So we look at a urine test for an organic acid, where we look at 70 different metabolites and about 20 different metabolites of bacteria that are produced in the gut.
Yeah.
And there are a couple of these chemicals that are found in the urine that should not be there, and they actually influence the neurochemistry in the brain.
Mm-hmm.
So, and they're created by Clostridia bacteria in the gut, and we look at this chemical. The acronym is HPA. It's a test I do on everybody with ADHD, particularly those that are kind of aggressive and hyperactive. And if that's elevated, again, interfering with dopamine metabolism in the brain, we need to bring it down, and we would use high-dose probiotics. Oftentimes that's sufficient. Occasionally we need to use a targeted antibiotic.
Mm-hmm. So which laboratory do you use in that regard, if you don't mind?
Sure. For that test, I found there for this particular chemical, the Great Plains Laboratory in Kansas is the one where we get the most results for that test. They're the ones who actually developed that test a number of years ago.
Yeah, Jim, that's my favorite too for gut dysbiosis. We do that. Anybody that's got a treatment failure, we do everything we can to encourage them to do that. And listeners, you need to know that a lot of insurances do cover that particular test. Some of them don't. Those tests are expensive if they don't cover it, but they could be life-changing. And I think it's great that you're really looking into that, Jim, and really think about what's going on. By the way, listeners, you may be interested. I've had a very interesting, one of the tests that comes up in that test is for Candida. And, the whole Candida issue and biofilm issue is an important one that we discussed here at Core Brain Journal a couple of sessions ago. I think it was 96, 97, and it's on biofilm, and you might be interested in going back to that. Do you do much work with Candida and biofilm? What do you think about that, Jim?
No, I think it's critical. In the, the late 70s, 80s, when the Candida yeast was getting a lot of, lay press, and it was everybody's problem, it kind of now is out of favor, so it's kind of seen as a fad. But absolutely, there's a subset of ADHD kids who had taken many antibiotics for ear infections, and they have overgrowth of Candida. And we use different kinds of probiotics. Sometimes we use antifungals, or not every kid with ADHD, but a subset, and we see it. And if we don't treat the yeast, they're not going to get better.
Yeah, it's very interesting. Jim, just as two guys talking, what I did is I got into it a long time ago. Actually, I was in Candida denial. I don't know if you had that phase in your career. Early on when I started doing testing, I was very interested in all the oats organic acid test. The acronym is oats with Great Plains. And I got interested in it, but somebody said in one of the meetings, Candida is going to take care of itself if you use probiotics and you get the gut squared away and get the bowel turned around. And yet, over time, I would have treatment failure based on my following that plan. And that's when I got interested more into the whole biofilm and all that sort of thing, because it was really quite interesting that some people don't respond just to probiotics. And this is making your point. It's to your point, Jim, that you can't just say, okay, they've got a bowel problem, give them probiotics. Because these situations that come up are far more than, hey, okay, it's a Candida problem just because they have a bowel problem.
Absolutely.
So then what else?
Yeah, it's complicated.
Sorry.
No, it's complicated. And sometimes we want the simple fix, but we, really struggle and work hard to get that individual assessment on what's going on for that child or that adult.
Yeah, you'll get a kick out of this, Jim. One of my favorite questions in every initial interview is, how many times a day do you go number 2?
Right.
It's probably a favorite of yours because we're on the same path.
Absolutely.
We get a lot of mileage out of it, and we have a handout for people from the Mayo Clinic on the transit time so they can do a 69-cent test to see what their transit time is from the mouth to the south. And, it works out. The transit time from the Mayo Clinic is 12 to 24 hours. And that's, and we do it with a very expensive, sophisticated corn test, where they actually eat the can of corn or half a can of corn, look at their watch and see how long it takes to hit the toilet. It's very, very complicated.
Right.
So, but anyway, that's to that point. What else do you find useful? You were mentioning some other things. What else do you find useful that you tend to rely on and look for in that Great Plains test? That's a big one for you to focus on.
Well, the other test that I think is critical for the younger kids under 10, 12 in particular is food allergy testing. So oftentimes our young kids under 6, hyperactive, kicked out of preschool, we can do a food allergy test looking at what's called IgG. It's not your typical immediate hypersensitivity where you get this rash or anaphylactic reaction, but there are behavioral problems. It could be milk, it could be dairy, it could be tomatoes, it could be healthy foods. But oftentimes eliminating those foods in these young kids can make a huge difference in behavior.
Well, what happens, and to just amplify on that point a little bit, Jim, because I'm so glad you brought it up. I mean, that's one that I usually bring up on the front end because to me that's the tip of Mount Everest, and the Candida and other problems down the road are at the tree line. But if you get all the way up at the tip of Mount Everest, it's going to be those IgG problems. And, I don't know how it is in Boston. I think when you're in a larger metropolitan area, individuals are more open to this kind of testing. I mean, we're in the Tidewater area, and Tidewater is really, it's a large area, but it's still, in certain respects, from a medical point of view, a small southern town, in terms of the way they look at some of these innovative tests. And so I always tell people if they have a question, because they'll go to one of their allergists in town and he'll say, well, he doesn't use the word quackery, but he comes pretty close to it. And I say, well, it's really simple. I'm hanging with the chairman of the Department of Pediatric Gastroenterology at Harvard on this, Alessio Faisano, and he speaks internationally on this subject. So I'm really living with the big dogs, even though he's not a personal friend of mine. That's what the literature shows. And so I dropped that in. Are you having to be as defensive as I am up there in the Boston area?
Well, I think 20 years ago, 30 years ago, I was, and I had to be. But at this point, I think the science, the research has come out to support all the work in functional medicine, particularly as it relates to psychiatry now. Mm-hmm. And so now we're being asked to talk at grand rounds and meeting with pediatricians and psychiatrists because they're looking for this information because their patients know more than they do. Good for you. So things have changed.
Good for you. I'm so glad you wrote the book. That's really right on. It's fantastic. So then you put them on a diet. Then the issue is, if they're on the diet, let's talk a little bit with our audience about what you do to help them stay on the diet and what you think about long-term management of a diet and that sort of long-term follow-up situation. What do you do with that in your office?
Well, I think one of the most important parts of compliance is helping the parents, stop criticizing and kind of be more understanding and listen more to their kids. So I think that's a really important part. So there's a team approach, not, blame. Mm-hmm. And the other part is if we address the kind of underlying deficiency, then these kids are going to focus better, feel better, and behavior will improve. So there's just kind of that positive feedback that just makes it much easier to work with either the parents and or the therapist. So I think if they can buy into understanding there might be some changes in the diet, they might need to take some supplements, that they're much better able to be energized and hopeful that things will get better for them.
So please share with the audience what your experience is when you get a person on an immunoglobulin G, what I call that the ghost immunoglobulin, because people don't see it. I call IgE the emergency immunoglobulin. So what happens is it's easy to explain because E is something you can see and G is not something you can see. And people then rationalize, I can go off the diet because I don't have any symptoms. Well, you didn't have symptoms, obviously, in the first place. But
right.
What's your experience with how soon, from your practice, people come around when they get on the diet and they really follow the protocol, and actually when can you see improvement? What's your thought about that?
For the younger kids, it's usually more dramatic, and oftentimes, they'll see a difference in 2 to 4 weeks. Sometimes you can have kind of withdrawal and irritability when you remove offending foods, but it's usually 2 to 4 weeks. Parents will notice a difference. Mm-hmm. Things always get better. For any of the nutritional plans, I always recommend this kind of 1 to 3 months monitoring. And other than the young kids, like let's say 6 and under, where sometimes food allergy is sufficient to reverse some of the symptoms, most of the time we're also looking at nutritional deficiencies, sometimes magnesium and zinc. So it's kind of a multi-step process, adding either different supplements or subtracting foods at different times.
So now you're tiptoeing in. I was listening to you carefully, Jim. You're tiptoeing into trace elements. So let's talk about that lab and how you do that and what your thoughts are about the trace elements.
Sure. I mean, I think the first chapter in this ADHD book is on magnesium deficiency, because I was kept rearranging the chapters. But when I thought about what is the most important supplement that everyone should take with ADHD, regardless of whether they can afford any testing, where I've seen the most dramatic results, is simple. It's magnesium. So magnesium deficiency is common, probably the most common deficiency I see, kind of contradicting what I said earlier when everybody is slightly different. Mm-hmm. Magnesium deficiency is pretty much universal in the kids and adults we're seeing with ADHD.
Mm-hmm. So do you test that? Please, I interrupt you. I apologize. Go ahead. What were you going to say?
No. And the other nutritional deficiency that we often see is actually zinc deficiency and elevated copper. They're kind of like on a seesaw. So we see high copper and low zinc. Also very common in a subset, almost half of the kids we're seeing with ADHD. And if we can get the magnesium in line and the magnesium and the zinc and copper in line, we're often much better able to kind of utilize some of the other therapeutic approaches we would want.
I apologize, Jim. I got excited about the magnesium point, and I was jumping right in there. So how do you tell our audience how you measure those things? What do you do in your office?
Magnesium is actually tough to measure because 99% of it is in our bones and cells. So if you do a blood test, most people have normal magnesium, even if you're deficient. So I look at a couple things. I look at a mineral analysis, looking at ratios of magnesium to calcium. That's been accurate. Mm-hmm. Been looking at that for almost 30 years. I also look at a red blood cell magnesium, and that can be helpful.
Stop right there, because I think those are two different tests. Let's elaborate on that for our audience. So the hair analysis, do you use trace elements, or who do you use?
I've used both trace elements and Great Plains as a good hair. They both look at the things that I need.
No, that's that. I've been using trace elements. I haven't gotten over to Great Plains. I love the trace elements ratio matter, so they can really see what's going on the heavy metals. Even if the heavy metals are not an obvious problem, they are a problem if you really look at the ratios.
Yes, and I used that test for 20 years.
That's great. That's fantastic. So Then you were talking about another one, though, which got away from that because you were talking about cellular magnesium. Let's talk a little bit about that test and how that applies to people who are recalcitrant, treatment failure. You don't know what to do with them. Magnesium's a big thing. Tell us a little bit about your observations about that, your experience there.
Yeah, sure. It's a blood test. It's called red blood cell magnesium. So it's looking at the magnesium in the cell, so it's not just in the serum. So it's a little more accurate, and any lab will be able to do that test.
Mm-hmm. So then, are you familiar with Walsh protocol at all? William Walsh?
Yes, sure.
Yeah, so
yeah.
He's a guy that we've interviewed here. I don't know if you knew, but he's at Core Brain Journal 025. We had him on for 3 hours, one for methylation, one on copper and cryptopyrrol, and one on bipolar and schizophrenia. But those were interesting interviews, and they're all hooked up on 025. But we've gotten a lot of mileage out of that. He's a very interesting, significantly contributory guy to the evolution of what you're talking about here.
Yes, he's been doing this for a long time, and certainly the copper-zinc ratios, he did a lot of early work with that.
So then how do you treat the magnesium? What is your favorite way of adding supplements in for magnesium supplementation, Jim?
Well, magnesium should be given at least a couple of times a day. It's hard to take it all at once. So there's magnesium liquid, there's magnesium pills, glycinate, citrate, and there's also powders. Mm-hmm. So there's some powders that you can mix in beverages for kids that can't swallow pills yet. There's also rubbing magnesium on the skin, which I haven't used as much because it's burning for some individuals, but there's some transdermal magnesium. And then there's all the Epsom salt. People take a magnesium bath with Epsom salt, which is a magnesium sulfate solution.
I haven't used that. That's an interesting thing. You have some mileage and had some experience with Epsom salt baths.
Yeah, people find it very calming. I think if the kids that I see, it might not be sufficient, but before bed, you do absorb some magnesium, and it is calming and can be helpful.
So then what do you think about, and I have limited experience with omega-3 fatty acids, measuring them and thinking about them, but it seems that many people are very fascinated with omega-3 fatty acids as an intervention. What's your thought about measuring that omega-3 fatty acids and treating it?
Again, ideally, I do like to measure them. I think that for most of my ADHD kids, I just recommend to minimize the testing. But what we found, and there's been research going off and on for almost 20 years, that where some psychiatric illnesses, the omega-3s are better. For the ADHD group, a couple of studies showed they were also deficient in one of the omega-6s, the essential fatty acids, GLA. Mm-hmm. So my preference is to give what's called an essential fatty acid supplement at least twice a day that has both DHA and maybe EPA, the omega-3s, with the omega-6 GLA.
Mm-hmm. Interesting. Mm-hmm. Doing a very
giving too much of just the... Yes.
I interrupt you. Sorry, but you do the balanced approach.
Yes, and there's research to show that just the high dose omega-3s is not sufficient. Mm-hmm. Some kids didn't get better, but when they added the omega-6, they did get better. So I use a combination.
Well, that's something that Bill Walsh talks a lot about with cryptopyrrol, because a lot of the kids who are really oppositional defiant, who have, who are very reactive to external stimuli, are in fact loaded with cryptopyrrol. I just had a person that I measured here, wasn't a child, but the male patient came in, and his cryptopyrrol. The top in cryptopyrrol should be 12 of something like that, 10, 12. I think 15 is the top before you start to have a problem. And he was 555 on cryptopyrrol. And
wow,
that's very he was in paralysis. He was jumping, and we're working with him now. I haven't seen him since this was last week, a couple weeks ago. But it's very interesting, and so the 6s are much better for the cryptopyrrol. And I'm with you 100%, Jim, on measurement. I think what happens for us as practitioners over on the more scientific side, if you will, on the more biologic side, because some of this is not credible to the ordinary person, and people are still so fascinated with hyperactive and inattentive. The measuring is the absolute way to go, because you can't argue with laboratory results. And there is a deficiency, there is an excess, and we seek to correct it. So how?
Yeah, the rest of medicine.
Go ahead. I'm sorry.
It has all these objective tests, and we just need to do a better job in psychiatry, certainly with our kids.
So what do you recommend for follow-up then, Jim, when you have somebody that you see and you started a program with them? When and what's your protocol for retesting? Do you wait 3 months? Do you wait 6 months? What's your own personal take on what works best for your patient population?
Most of the time, 3 months would be too early, because we're not going to see the changes, or it's pretty obvious we're going to see the changes, but I know they're supplementing. Mm-hmm. So I really focus on the retesting more on clinically, how someone's doing, and typically perhaps around the 6-month time might relook at some of these deficiencies to see if they've been restored to normal levels.
Mm-hmm. So then, have you ever worked with neurotransmitters per se? I had a period of time where I was working directly with neurotransmitters a great deal. Do you recommend them? Do you cover them in your book? What's your thought about neurotransmitter measurement and neurotransmitter precursors?
Well, there's a chapter in the book, and I have been using for years the neurotransmitter precursors. So amino acids are the precursors to the dopamine and norepinephrine and serotonin in the brain, mm-hmm. which is kind of what the medications used to manipulate. So I focus on the precursors. I have not found the neurotransmitter testing to be 100% accurate, so it's hard for me to mm-hmm. pick and choose. Sometimes it helps, sometimes it doesn't. So I have not done as much of the urine neurotransmitter testing as I used to, and I focus on, again, the organic acid and using amino acid precursors based either on amino acid levels, which I do check, and the breakdown products, which are in the organic acid.
Yeah, we're on the same path there. I spent a long time working with Neuroscience, and just found them increasingly less predictable. For the money that it costs. I mean, the idea, it's provocative, it's interesting, but it just didn't seem to be as effective as it should be for the cost of the supplements and so on.
I agree 100%. I think it sounds so powerful and kind of sexy, and a lot of primary care doctors are doing it, never treated mental health issues. But it's just not a consistent report. So
then, Jim, I'm sorry to keep putting you on the spot, but this is so helpful. And, this is going to be good to really read your book and get into it, because I know I'm going to learn something from you by getting into it, because you have a different experience with some of these things than I do. The issue then is, how do you measure the amino acids? What technique do you use? What testing do you use?
I use a fasting plasma amino acid level, and Great Plains has one, and Metametrics has one. Mm-hmm. So it's fasting amino acids, and it really does not have anything to do with what someone ate the day before, the night before. It has to do with your ability to break down protein and digest it. So I have found it a very accurate, helpful tool for me. For both depression and ADHD.
That's very interesting. I haven't used that. It's a blood test.
Correct. Yeah.
That's interesting. I'm not familiar with that. While we're on that subject, have you used the Great Plains toxic test for comorbid conditions where people have other toxic elements? I haven't used it much, and I'm just asking because it's a relatively new test, and I thought it might be interesting to discuss it a little bit.
Yeah, I'm actually, going to give a talk with Dr. Shaw up in New Hampshire in June, and he'll be discussing that test as well as other kind of environmental agents that can contribute to ADHD. I have personally not used that test yet.
Yeah, I heard him talk at IMMH in Washington, in D.C., and became enthusiastic about it. But I just, when you don't know how to use it effectively, it was a very interesting talk, provocative. I have one person who happens to be a senior officer in the Navy down here in Tidewater who has developed a shaking kind of palsy, and he's a young guy, and we're looking forward to seeing what we're going to do that test for him. And I think it's absolutely indicated. I mean, we're getting off the subject of ADHD, but I'm looking forward, and I know you'll be interested to hearing Dr. Shaw. Dr. Shaw, folks, is the medical director, clinical director, CEO, whatever, of Great Plains, and he's a thought leader for these issues of ADHD, autism. He's written a significant book on autism and biomedical testing, and he's the person who developed the testing that we're talking about with the Candida and the variety of 72 tests that come up with the oats testing. So you're going to enjoy that one, Jim. I'm going to be envious not being there.
Right.
So then, what else comes to mind? We're running out of time a little bit. We're down to almost 40 minutes here, and as we wind up, let's try to see: are there any other hot items that are actionable that you might recommend for our audience? We're going to talk about how we can contact you in just a minute, but do you have any other things that you say, hey, this is something we didn't quite cover enough, and I want to make sure we get this in?
Well, some of the areas that were very good research with ADHD are things like sleep deprivation, not getting enough sleep, and sleep disorders in young children transitioning to ADHD. So that's really been important, as well as exercise and nature. So we have a whole chapter on nature and how that affects kids. So being out in the woods has been incredibly helpful. So there's a whole bunch of lifestyle changes and things that we can use, not just nutrition, not just medications, to support our kids with ADHD symptoms.
I can see why you would be inspired up there by Walden Pond to think about nature, because you live in God's country up there. That's beautiful.
Yes, no, we enjoy it, and there's a lot that we can do with our kids.
So, Jim, tell us how we can contact you. I know a number of people might be interested in actually doing a consult with you. Do you do virtual consults, for example?
Yes, we consult with individuals around the country or other practitioners who are trying to learn a functional medicine approach for psychiatry. And the book website is called finallyfocusedbook.com. Okay. And there's research and blogs and writings, and that's probably the easiest way to reach us.
Finallyfocusedbook.com, folks. Well, thank you so much. This has been a very interesting. We're two brothers from a different mother, Jim. I'm telling you. I appreciate the work you're doing. That's great. Well, I enjoyed talking to you so much because you've been down some different paths, and I appreciate your sharing some of those observations with us and with me personally. It's been very helpful. So, Dr. James Greenblatt, thank you very much for joining us. I look forward to talking with you again one day, perhaps running into at a meeting down the road.
Absolutely. Looking forward to it.
Thanks for listening to Core Brain Journal. We're working every day behind the scenes to bring you reports that connect research benches with those street trenches. Here we share the complexity of mind science because, as you know, details really do matter. One of the most pervasive, misunderstood challenges is how commonplace medications, like those written for ADHD, are used so regularly without clear guidelines. If you think you'd like more specifics, take a minute to download my 2-page PDF packed with video links and references on the absolute essentials of how to start ADHD medications. They're easily available at corebrainjournal.com/start. Thanks for listening. Do connect and stay tuned. Together we can make a difference.